Hello and welcome back. If you're just tuning in, you're watching the Arthritis Show, a global information source dedicated to patients with arthritis and sports injuries. Well, joining us today in our studios is Dr. Chad Baile. Dr. Chad Baile is acupuncturist here from South Florida. Welcome, Doc.
How you doing?
Great to have you.
Nice
How you been?
Very good.
Now, you practice acupuncture in South Florida. What percentage of your patients do have arthritis and sports injuries?
I would say probably 25% of my patients are pain-related syndromes, arthritis, sports injuries.
And off of that, do you see knee pain most commonly, or
Knee, back pain. Back pain's a big one, sure. Particularly my arthritis patients, knees, ankles, and wrists. Wrists are very big as well.
Okay. And we were just talking to Dr. Schwartz, who also does acupuncture and Qigong.
Yes.
And we wanted to ask him what is Qi and all that, but time didn't allow that. So if you could go over that, that'd be great.
Sure. You can think of Qi as a bioelectric energy that's inside our body, and it runs all of our systems. Most people think of it as the nervous system as containing electric, but actually all of our systems contain a little bit of electricity. And what acupuncture really does is it's a way for us to manipulate that energy. If that energy gets blocked or stuck, if that energy is weak for some reason, we can use acupuncture to balance that out. You know, bring more energy to the system or clear it out if it needs cleared.
Excellent. Now, we were talking about some of these acupressures. Like we spoke about this particular acupressure. We're teaching our patients out there how to apply that for headache.
Yes.
How does, for some of those people who are not clear on that, how does pressing here would possibly help some of the other parts of the body?
Well, this point is it's a point called large intestine 4, and it actually matches up with a point in the same spot on your foot called liver 3. And those 4 points, both hands and both feet, are called the 4 gates. And the 4 gates are actually the best 4 points in the body to open up energy flow and to get energy flowing and moving. And particularly for someone with arthritis, a lot of what arthritis is that energy is blocked in those joints, particularly the painful ones. And if we can get that energy to flow and be smooth, the pain starts to go away.
Fantastic. Now, we see a lot of knee pain, and my understanding is for the knee pain, usually they use about 4 to 5 possibly needle, or
Yes. Usually for knee pain, you're going to have probably about 4 needles in the area of the knees themselves, but you're also going to have some points down in the feet. Kind of the way you can think of acupuncture is that we want the energy to move in the local area of pain, the knee, but probably the most important points are the ones down on the feet that are actually releasing that excess energy and letting it, release from the body.
Fantastic. Now, one of the things that we get to see in our orthopedic clinic, somehow the female population is probably like 60 to 70% to male 30 to 40. Is that the feedback you get?
I would say so too.
I believe that the reason behind it is just ladies are more conscious about their health, and they go look for a physician as soon as they break down. They want to look for a physician sooner than as opposed to the guys. They just kind of blow it off a little bit.
Yes. I think that, and I also think men in general are a little more active. They're a little bit more prone to being in exercise and sports, and I think being active is one thing that can keep you from developing arthritis, because it allows that energy to keep moving and flowing throughout your life.
Fantastic. Roman Garcia, I think you had a question.
Is there a difference between a male and a female patient in how you treat them?
Well, there's a difference between any patient that you treat. I would say acupuncture is very individual. So say for you and for him, the treatments are going to be completely different just because of your individual energies. And so, yes,
it has to
between
be
a man and a woman, it's definitely going to be different as well.
But the points are similar, no matter the gender.
Similar, but individualized to your specific case. Like if it's your knees or, if there's things that are related. Sometimes you also see that, women tend to have more, in Chinese medicine, what are called damp symptoms. And that dampness can relate a lot to joint pain, particularly arthritis.
For some folks who are seeking acupuncture as a treatment, should they go through their, should they call their insurance to inquire whether it's reimbursable? Do most insurance reimburse nowadays for acupuncture?
Actually, most insurances do. The best thing to possibly do is if you want to get treatment, find an office, and then you give them your insurance information. They'll check all your benefits and let you know what you have.
So as time goes on, acupuncture is more and more used in a standard, kind of like a standard, being brought into the umbrella of...
When I first graduated school back in the 90s, we didn't even consider insurance. Like, we just said, nah, we're just going to do cash practice. But, you know, over the last 10 years, it's really changed a lot now. And
the trend is changing.
Yes.
Insurance companies are believing in the acupuncture.
They really are.
They're doing reimbursement.
Is that because studies have been conducted, have proved the effectiveness of it, or is it because of pressure from the insurers?
I think both. I think, yes, it's been out there longer, so, you know, more studies have been done, but I also think it's because, you know, people are just looking for things that are working. And sometimes when they're not getting results with medications, acupuncture is, you know, an obvious alternative.
And does acupuncture, does it have the potential to be used with most medical conditions that a human body would experience?
Sure. When I first graduated from school, I really thought I was going to be a sports medicine acupuncturist. I was going to work with athletes. That's actually what I was doing a lot in school. And I just decided, once I got out and started practicing, I started seeing everything. Everything from insomnia to pain to fibromyalgia, arthritis, back pain, digestive disorders, skin disorders, and acupuncture can work with all of it. So as opposed to just specifying with, you know, sports injuries, I kind of have seen everything now.
Fantastic. Doc, for people who want to get in touch with you, I want to put your information up there.
Sure.
How could they get in touch? Do you have a website?
Yeah, they can go to www.shinwellness.com. And Shin's phone number is 305-571-9090.
Perfect. Well, that's all the time that we have today for this arthritis show today. Make sure you join us for Monday. On Monday's show, Dr. Martin Dayton will be joining us, and Dana Brody, our nutritional consultant. Again, I wanted to take a moment and personally thank Dr. Chad Baile for coming. Doc, thank you again.
Thank you.
As well as Dr. Sherwood Schwartz. Have a great weekend.